Welcome, dear learners. I hope all of you are doing very well. And I, Dr. Noor Abdul Qadir, Assistant Professor in the Department of Education, Aligarh Muslim University, welcomes you all on this Swayam platform on a very particular and interesting topic. Yes, it is about India's health tradition. Exactly. Health is very important, and it is the health condition of a person that determines the mind of the person and the rest of his life, isn't it? So here in this lecture we will be very particularly talking about the Ayurveda system and the Susruta and the Charaka Samhitas. So let's move on. At the onset itself, I would like to give you a just general introduction about Ayurveda, which is a renowned traditional system of medicine. Ayurveda, isn't it? The term itself indicates it is from the time immemorial, that is from the ancient period itself, we have received this system of medicine which has been flourished from the ages, and it is still having very particular relevance. So we may think that Ayurveda, which has evolved from the ages, what it has to do in this particular era or in this technotronic world, you may be having this doubt. Sometimes we all may be having this doubt. No. Ayurveda, which is having an enormous knowledge of nature-based medicines. Today, we all want to retrospect, right? We want to go back to the nature. Everyone is behind the product which is organic in nature, isn't it? Why is it so? Of course, it is because of the side effects of the other medicines, right? So, Ayurveda is a system of medicine which is having enormous nature based, see, for example, plant based medicine, and still it is having relevance. Why? Because it is making certain correlations, it is making certain connections. What connections? The connection between the mind and the body, the connection between the human body and the nature, the prakriti. And it is also making the connection between the elements of the universe. And maybe because of that, not maybe, I can say for sure, it is because of that it will continue to flourish in ages still to come. Since that bond between the person and the nature, between the human body and the elements of the universe, which is always existing, because of that connection which Ayurveda, the traditional system of medicine, makes, because of that we can say that it will continue to flourish in ages still to come. Okay, so that was a general introduction with respect to Ayurveda. Now, there are many avenues still to be explored. We have explored a lot with respect to Ayurveda, but there are still a lot of avenues like researchers, investigators, doctors, and many disciples. They have to explore more on Ayurveda because we know that they are carrying the responsibility of keeping the traditional system of medicine, that is TSM's, traditional system of medicine. And we know the traditional system of medicine, that is Ayush, isn't it? Ayush is one of the traditional system of medicine which includes Ayurveda, Yoga, Unani, Siddha, Homeo, and it has also included the naturopathy. Because it is the researches that we are conducting that will contribute to the growth of the traditional system of medicines in future. Also, but when we are looking into the researchers, that have been conducting in the particular area of the traditional system of medicine, there are certain barriers, there are certain hurdles, just like that lack of literature sources in different languages and also insufficient awareness about the basic principles and the histories of the systems. Because we know that in earlier period itself, sometimes it may be with the help of the secondary sources we may get information. Many of the primary sources must have lost. We may not get sufficient information with respect to different medicinal practices or different medicines. So maybe because of that also, and also the literature are in different languages. So everyone we may not be able to translate it exactly or very particularly into the concerned languages. So because of that reasons, we may see that there is a lacuna of exchange of information from systems around the globe. So that is a pitfall or that is a drawback, but that doesn't mean that we are not conducting researches in the field of the traditional system of medicine. It is still going on and it will continue. Let's have a look on history of Ayurveda. When we are looking into the history of Ayurveda, it has an old age history since 2nd century BC, and it is laying its foundations based on various philosophical teachings, various schools of philosophy like Vaisheshika, Nyaya, Sankhya, Mimamsaka. So there are different schools of philosophy, and Ayurveda, when we are taking into consideration the history of Ayurveda, it is also laying foundations on basically three schools of philosophy, that is Nyaya, Sankhya and also Vaisheshika. Now let's see how it is contributing as a foundation for Ayurveda. If you are considering Vaisheshika, it is one of the ancient schools of philosophical teaching, and as far as Vaisheshika is concerned, it is talking about the inferences and the perceptions that should be obtained by considering the pathological condition of a person. After considering the pathological condition of the person, what are the inferences and perceptions that we are getting after looking into the symptoms? That is given by Vaisheshika. And school of logic, that is termed as the Nyaya. As far as Nyaya school of philosophy is concerned, it is propagated on the basis that one should have an extensive knowledge, whoever, whether it is a sage or a disciple or a doctor, whoever it is, the person should have an extensive knowledge of the patient's condition and the disease condition before proceeding into a treatment. That means a proper analysis about the condition of the person should be gained before we are moving into a particular treatment, and that is given by the school of logic, which is termed as the Nyaya school of philosophy, and it is also related to the manifestation framework, which is given by the Sankhya philosophy also. So these are the three basic schools of philosophy which lay as a foundation as far as the history of Ayurveda is concerned. So I hope it is clear. Let's have a retrospection. Even though we discussed about the various schools of philosophy like Sankhya, Nyaya and Vaisheshika, but still the history of Ayurveda, it was established even before. The origin of Ayurveda is considered to be divine from the Hindu god, that is Brahma, Brahma the creator. We know that Brahma the creator, Vishnu the preserver, isn't it? So that means Brahma, who is called as the creator of the universe, and as far as the history of Ayurveda is concerned, we know that it is dated long back. If we are taking religion as a consideration, or if we consider as the particular stage into consideration, it is considered as it came from the Hindu god, that is the Brahma. Okay, so when we are looking into what is the hierarchy, okay, how this from the Brahma, that is the creator, how it is being distributed or how it came to the common man. So there is a succession path, we can say, or a hierarchical path, that is from the creator of the universe, it is being transferred to the sages for the well-being of the mankind, and from the sages it is moving to the disciples, and from the disciples it is to the common man by various writings and also through oral narration. So that is the simple succession, we can say, or hierarchy, from where the flow of this knowledge of the traditional system of medicine came from the creator of the universe, that is the Brahma, to the common man. Also, the information, whatever information about the healing procedures in Ayurveda, it is being compiled and composed in the form of poetry, which is known as the shlokas. It is in the form of shlokas, that is the composition of the healing properties or the healing practices of the herbs, especially with respect to Ayurveda. It is being composed in the form of shlokas. So let's have an example of one or two shlokas. Okay, I have taken a few example, a few to ponder. Okay. मनसि यदि स्वस्थता नास्ति तर्हि शरीरस्य स्वस्थता नास्ति. And what does it mean? If the mind is not healthy, the body cannot remain healthy. That is what the lecture started, isn't it? Health is more important. And in order to make you more healthy, you have to make your thinking process good. Ayurveda is giving more importance to the mind of a person. Every time if you're thinking about others, you are getting jealous of others. You are thinking about let the position of the person is deteriorated. If you are thinking on that, if your mind is not healthy, your body cannot remain healthy. Manashuddhi, vajashuddhi, karma shuddhischa sadhanam. Purity in thought, word and action is the true discipline, isn't it? Most of the philosophical principle is giving this. Even the Ashtanga philosophy of Buddhism is also giving you this. That is the eightfold path of Gautama Buddha, is giving you everything should be good. Your thinking, your words, your process, the way you talk, the way even all the sense organs should be very beautifully, very beautifully used by the person. Adi sarvatra varjayat. Avoid excess in everything. Of course, we know that even if it is amrit, isn't it? If you consume it in excess, it becomes poison. So, adi sarvatra varjayat. Avoid excess in everything. So, these are the few for my perusal and also for your perusal. I have taken a few shlokas for your kind information. So now let's move on to the system of healing. So here, the system of healing is believed to be based on the four Vedas, that is the Rig Veda, Yajurveda, Samaveda and the Atharva Veda. So the complete system of healing in Ayurveda is mainly based on the eminent compilations of the Vedas, and from this, the Rig Veda is considered as the most well-known of the four Vedas, which is having a description of the 67 plants and 1028 shlokas. The Atharva Veda and the Yajurveda describes 293 and 81 medicinally useful plants respectively. So we can say that the basis of the healing practices comes from the composition of knowledge, that is the Vedas. I hope it is clear. From the system of healing, we are moving to the basic doctrine principles of Ayurveda. Ayurveda believes that the entire universe, the whole universe is composed of mainly 5 elements, that is Vayu, the air, Jal, water, Prithvi, the earth, Akash, the space and Teja, the fire. These are the 5 major elements based on the whole universe is composed and which is unanimously known as the Pancha Mahabhuta. It is known as the Pancha, that means the 5. Pancha Mahabhuta. Vayu, Jal, Prithvi, Agash and Teja, that is the Pancha Mahabhuta. And this Pancha Mahabhuta forms the 3 basic humors of human body in varying combinations. According to Ayurveda, every human body is having a typical varying combinations. And what are they? Pitta dosha, Kapha dosha and Vata dosha, isn't it? And these 3 are unanimously known as the Tridoshas, that is the three, isn't it? Pitta dosha, Kapha dosha and Vata dosha. These are Panchamahabhuta forms the 3 basic humors of the human body, and let's see what are those. The Tridoshas, the 3 energies of the body, when we are discussing about Vata, which means that it controls movements in the body like breathing, blinking and also the muscle action. If you are taking Pitta, it controls the digestions and the metabolism of the person. Kaba, it controls the structure and the lubrication of the body, just like bones, muscles, and also the fluids. We can, in a nutshell, we can say that in Ayurveda, it is believed that there should be a perfect balance between the nature elements and also the tridoshas of the human body, so that a healthy state of living could be maintained. So in order to maintain a healthy state of living, we should have a perfect or a proportionate balance between the nature elements and the tridoshas, that is the Pancha Mahabhutas and the tridoshas should be having a particular balance so that we can maintain a healthy lifestyle. Okay, so that is all about the basic doctrine principles of Ayurveda. From this, we will be moving on to the method of therapy. The method of therapy, as far as Ayurveda is concerned, it is known as the Panchakarma. That means the 5 karmas. That means 5 activities are there as far as the medicinal therapy or the method of therapy as far as Ayurveda is concerned. Now let's see what is Panchakarma. Panchakarma therapy means it applies the various processes for the rejuvenation of the body, cleansing and enhancing the longevity of the body. Now, what are those karma? What are those activities or actions that we are doing in Ayurveda, which is known as the Panchakarma treatment? And first one is Virejan. Virejan means it is a kind of purgation by using kind of powders, paste or decoction. We used to do the Virejan. And after Virejan, we are moving on to the Vaman. Vaman means it is a forced therapeutic emesis by use of some medicine, which is known as the Vaman. And the third one among the Panchakarma is the Basti, that means use of enemas prepared from medicated oils, that is the Basti. And moving on to the third one, that is the Rakta Moksha, that is the detoxification. We are detoxing, that means removing the toxins from the body, that is Rakta Moksha. And finally, it is Nasya. Nasya means through the nostrils we are administering certain medicines, and it can be in the form of oils or it can be certain fluids, and later on we are inserting or we are applying fumes through the nasal route. So that process is known as the Nasya. So that is the Panchakarma treatment, which is starting from the Virejan through the Vaman, Basti, Rakta Moksha, and finally we are moving on to the Nasya. So this is what known as the method of therapy, that is the Panchakarma in Ayurveda. Now, in practice, usually we can say that Ayurveda has 8 disciplines called Ashtanga Ayurveda, which is known as the Ashtanga, 8 branches, Ashtanga Ayurveda. Now, what is Ashtanga Ayurveda? That is Kaya Chikitsa. Kaya Chikitsa means it is the internal medicine treatment. We are taking medicine into the body, that is Kaya Chikitsa. And the next one is Bhuda Vidya treatment. Bhuda Vidya treatments means it is for especially for the psychological disorders. And the next one is Kaumara Bhritya. Kaumara, as the term indicate, is that it is the pediatric treatment. Kaumara means that is child, that is for the pediatric treatment. And next one is that Rasayana, that means the study of the geriatrics. Geriatrics means the elderly people. And next one is the Vajikarana, that means treatment through aphrodisiacs and eugenics. That means we are rejuvenating the body, we are making the body more energetic, that is Vajikarana. And next one is Shalya, that is the surgical treatment. Surgical treatments are also taken place in Ayurveda. As we all know, Susruta, who is considered as the father of surgery, that is Shalya, that is the surgical treatment. And next one is Shalakya, that is ENT and also the ophthalmology. Ear, nose and throat is also coming in it, and also the ophthalmological treatment. And finally, that is Agadadandra, that is toxicological studies, how the especially with respect to the poisons and all, insects bite, snake bites and all, that particular ank is known as the Agada Tantra. So starting from the Kaya Chikitsa, Bhuda Vidya, Kaumara Vritya, Rasayana, Vajikarana, Shalya, Shalakya and Agadadandra, these 8 are considered as the 8 disciplines of Ayurveda, or otherwise known as the Ashtanga Ayurveda. I hope it is clear. And now from Ashtanga Ayurveda, we will move on to the current status of Ayurveda. So what is it about the current status of Ayurveda? We know that in recent decades, Ayurveda has experienced a considerable shift in its paradigm. There was a considerable shift in the paradigm of Ayurveda, and also there is significant changes in the outlook of the researchers, especially with respect to the application of Ayurveda. Along with that, we can say that the therapeutic principles of Ayurveda, which is focusing on the Prakriti and the Tridoshas, we have already discussed what is Tridosha. So there is a focus on Prakriti and Tridoshas, and these principles explain that every individual has a unique constitution. Every individual is different, and the constitution of every person, it is different, which is known as the Prakriti. And it is the Prakriti that is determining the characteristic response of each individual to medication. Every person's body will be responding in a different way to different medicine, which is not taken into consideration by the modern medicine. So that is a fact of Ayurveda. Ayurveda is telling that every person is having a unique constitution of Prakriti, and the response of a person to a particular treatment will be different. And apart from that, the environmental conditions and dietary factors of a person also matters a lot. Apart from that, genomics, that is a recently introduced research field, we can say, it bridges the gap between the genomics and Ayurveda. Usually there is a gap between genomics and Ayurveda, but the recently introduced genomics, it is bridging the gap between Ayurveda and genomics, and it is helping us in order to understand the inter-individual differences in response to therapies in various diseases. So that is a nutshell with respect to current status of Ayurveda. And now let's have a discussion on what is the future of Ayurveda. Of course, it is having a future, but how can we make it more better? Let's have a discussion on that. Global acceptance. Ayurveda is worldwide recognized, isn't it? Many of the Vedas and many of the textbooks of Ayurveda are considered as now many people in different countries, they are using, foreign countries also, they are studying on Ayurveda because it is a holistic system of health, which is mainly focusing on prevention rather than cure. Ayurveda is telling that how to prevent before moving into a particular disease, and it is also not treating the disease, it is treating the cause. So many countries are including it in their healthcare system because no one want to become a patient or no one want to become ill, right? So integration with modern medicine. The future of medicine also lies in the integrative healthcare combining Ayurveda with that of the modern medicinal research, which is moving from the diagnosis to treatment. Also, we can conduct various scientific researches. There is a necessity for validating various Ayurvedic herbs. So we can conduct research on that, and also various treatment using scientific tools so that the credibility and acceptance of Ayurvedic system of medicine could be boosted. And also digital and AI support. With the help of the digital system and also artificial intelligence support, Ayurvedic consultations, personalized diet charts and dosha analysis can also be made available online for everyone, so that we can make also use of that. Education and awareness. We need more Ayurvedic universities, we need more research centers in order to get better doctors, better Ayurvedic doctors and also researchers. Apart from that, there should be preventive health revolution. We know that we are living in a world of stress, we are living in a world of pollution, various other relationship issues. academic issues. So the people are always under stress, and we are living in a world of pollution also, and various lifestyle diseases. So Ayurveda is focusing on a balanced routine. It focuses on balance between the person and the elements of the universe, and also helps us to make our life more better and also more relevant. So that is what we can say with respect to the future of Ayurveda. And also, when we are looking into the perspective, we always had a convergent thinking with respect of Ayurveda. Now let's have a analytical, and let's have a divergent thinking with respect to Ayurveda, so that its acceptance could be increased in a global perspective. Along with that, we know that we have to foster the principles of Ayurveda to keep the age-old valuable system of medicine as a living tradition in future. We need to preserve it. We know that most of the herbs are at the stage of extinction, or many of them have already extinct. So we need to preserve it, isn't it? We need to conserve it. Documentation is also necessary, and apart from that, preservation is also necessary. So that was about the Ayurvedic system, or the traditional system of medicine, that is Ayurveda. We had a discussion on that. Now we are going to discuss about the various foundations which is considered as the base for the Ayurvedic system, and especially two foundations we are going to discuss over here, that is the Susruta Samhita and also the Charaka Samhita, which is together known as the Brihatrayi. Brihatrayi is together known as the great trilogy, which is refers to as the three foundational texts of Ayurveda. So three foundational texts are there, that is Susruta Samhita, Charaka Samhita, and also the Ashtanga Hridaya. And apart from this Ashtanga Hridaya, today we will be discussing more about Susruta Samhita and also the Charaka Samhita, which is together constituting the great trilogy, that is the Brihatrayi. Okay. So now let's move on to Susruta Samhita. Susruta Samhita is considered as being developed in the 7th and the 6th century BC. While moving on to Susruta Samhita, let's have a discussion with respect to who is Susruta. Susruta is considered as an Indian physician who is known as the father of surgery and also the father of plastic surgery. And he was a disciple of Dhanvantari, one of the Navratnas of King Vikramaditya. He was considered as the disciple of Dhanvantari, who is one of the Navratnas of the king Vikramaditya. And Susruta, he authored the Susruta Samhita, which is considered as one of the earliest texts of surgery. Especially, he has also done the plastic surgery also. Susruta Samhita is a part of Ayurveda's great trilogy. Trilogy we have already discussed. One of the part of the great trilogy, that is Susruta Samhita, Charaka Samhita and Ashtanga Hridaya. And alongside with Ashtanga Hridaya and Susruta Samhita, the various surgical treatments and procedures are being discussed in the Susruta Samhita. Susruta, he performed and documented over 300 surgical procedures. Imagine in that ancient period, 300 surgical procedures including plastic surgery, rhinoplasty, rebuilding of nose, gutter removal, fracture management, and even Caesar cut, Caesarean delivery was also done in that particular period. So, he was a person with enormous knowledge about the surgical treatment. Susruta Samhita, it was written by Susruta, emphasized the surgical matters, how surgery can be conducted. That surgical matters is being emphasized in that book, including the use of specific instruments and also various types of surgical treatments. It is in this work that one finds significant anatomical considerations of the ancient Hindu. That means the anatomical, the inside the body, what is the anatomical structure of the person. That wide description is also also being given in the Susruta Samhita. The knowledge of the human anatomy was revealed both by inspection of the surface of the human body and also through dissection of the human body. Dissection of the human body and superficial anatomical observation was also done. Why? Because according to Susruta, he believed that students aspiring to become surgeons, they should acquire a good knowledge of the structure of the human body. So that is why not only the superficial analysis, dissection also should be done in order to get a better analysis about the internal organs of the human body. This was a version of Susruta. Innovations as far as Susruta is concerned, we also already discussed about rhinoplasty, nasal reconstruction, skin grafting, cataract surgery, cesareans, removal of dead fetus, and lithotomy, that means surgical incision into the hollow organs of the body like urinary bladder, so that we can remove stones and all, or calculi that is existing in the kidney, pancreas. So such kind of surgical treatments were also considered as the innovations of Susruta. The Susruta Samhita also integrates anatomical knowledge, surgical training, patient care, hygiene, and also various other scientific observation was also being integrated along with the surgical, because we know that not only anatomical knowledge, we have to give training to the persons, and patient care after the surgery is very much important. Hygiene is very much important, so that infections should not be there, and various other scientific observations should also be there. Sushruta's teaching display principles of evidence-based medicine centuries before modern system emerged. So before this modern system of medicine, Sushruta's modus operandi was that it is also based on certain evidence-based medicines. He also developed many unique and practical techniques to dissect the human body and study its structure. There was particularly unique combinations of knowledge which was displayed by Susruta in Susruta Samhita with respect to the practical techniques to dissect the human body. Also, the Susruta Samhita provides details of toxicology, removing toxins from the body, what kind of toxins with respect to various bites of insects, and pediatrics, pharmacology, and other branches of the traditional system of Indian medicine known as the Ayurveda. After completing the Susruta Samhita, we are moving on to the Charaka. Charaka is known as the father of medicine, and he served as the royal physician of Kanishka, that is the Kushan kingdom, and he authored the Charaka Samhita, that is one of the foundational texts of Ayurveda. Now, Charaka dwelled in all aspects of medicine, including the logic and philosophy behind the Indian medical system, Indian medicinal system, and also he played emphasis on the diagnosis of disease and treated Ayurveda as a comprehensive system of health. He also elaborately discussed various subjects like fetal generation, anatomy of the human body, functions and malfunctions of the human body according to the Tridosha, and also the discussion based on the classification of various diseases. When we are moving on to Charaka Samhita, it covers topics such as physiology, diagnosis, prevention, and also internal medicine. Charaka emphasized ethics in medicine, highlighting the importance of the diet and also the various preventive care. Apart from that, it maintained authority for over 2 millennia and was translated into various other languages like Arabic, Latin, and various other foreign languages. Also, we can see that Charaka Samhita was later expanded by Dhridabala, making it an encyclopedic treatise. Also, he later, that is Dhridabala, he added later 17 chapters to the Charaka Samhita. So, in view, we can say that a consolidated description with respect to the human anatomy and various diseases that could be viewed in both the Charaka Samhita and also the Susruta Samhita. And also, I would like to discuss on this very particular aspect that other than Charaka Samhita and also Susruta Samhita, many additional writings like Bhela Samhita, Kashyapa, Agni Veshatandra, Madhana Nidana, and Ashtanga Hridaya and of Vagabhatta. So there are various other textbooks which have been evolved, but still we can say that Charaka Samhita, Susruta Samhita are the two basic foundational texts that became the base, which is giving a complete description with respect to the medicinal treatment of Ayurveda. So in conclusion, we can say that human as a person, with respect to its external anatomy and morphology, we can say that is being very truly and with purity is being considered by Ayurveda, which is treating the mind and the body of the person together. So I hope that today's lecture, which started from the Ayurveda system and coming into the two basic foundations of Susruta Samhita and Charaka Samhita, have been more effective for you in knowledge, more effective for you in thought provoking, and more effective for you in making a balanced life, making a connection between you and also the nature. So that was about the conclusion. Here are a few references for your perusal. Mainly it was from the Ayush medicinal treatment that I have taken most of the content. And thank you so much and have a nice day.